Side is a pain, right side?
More is left side. But overall, I feel stiffness and discomfort. So 10 years back, actually, I had the fluid coming out of my ear. So I consulted an ENT in Bangalore. So
where exactly is your pain starting?
I can't tell you why, but it will affect the whole face, and sometimes it will radiate back to my neck.
Okay. Do you have pain when you open and close your mouth?
Not that much.
But you have?
Little bit.
Can you bring your jaw forwards? Bring your two teeth together. You're also having pain in the forehead, is it?
Yeah, so sometimes. When I'm in ill condition, the pain will bring out.
Open. Bite. Bring it forward, your jaw. Keep it edge to edge. A little bit back. Bite. Yeah, keep it like that. Keep it like that. Close your lips. Okay, relax. Leave loose. Smile. Okay. See, you are having a problem with your lower jaw, for sure.
Yes.
The only thing I can't be sure is if the pain that you're having on the face is because of the problem in your jaw, but it could be.
Okay.
Your lower jaw has to come more forward, your joint is closing a lot, you've got deep bite and all that.
Yeah, and sometimes I have issues while speaking.
Exactly. So, even though there is no 100% assurance that your pain is going to get relieved if we sort out your jaw issues, I think it's worthwhile to consider solving your jaw problem. Because you're having incompetent lips,
Yes.
you've got retruded lower jaw, you've got a hyperclosing lower jaw, and you've got deep bite. All of this can be taken care of. By taking care of this, what will happen is your facial profile improves, your dental positioning improves.
Yes.
So I think that might solve your pain a little bit at least.
So to be honest, I'm not very much concerned regarding the aesthetics, but function.
But aesthetics and functions unfortunately go hand in hand.
Yes.
That's how nature is. You are having a major problem with your jaw. It could well be that is what is causing the pain on the lower side of the face. A lot of patients have had that problem.
Yes, sir.
Therefore, since you have tried multiple other treatments, since all those treatments have not been working well for you, this is an option you could consider. But we need to take scans for that, and I can tell you what we can do and how you can go about it.
So which is why I thought of seeing you.
Yeah, we can do that. I think because you've had so many treatments, you even had antidepressants, it's just not worth all of that. My first thing is we solve what we can solve, and then if you can't solve a particular thing, then it's secondary, right? But now you have a major issue.
Yes, sir.
Such a severe jaw deformity can lead to pains.
Yeah, and initially, when I consulted to my local dentist, they all suggest me ortho treatment.
No.
They'll properly
Just-
align my jaw
just-
and they'll expand palate. So
No, you will need surgery definitely.
okay. And one more, so during my previous diagnosis, they only said me about I have some issue in my left condyle.
There is a problem in your condyle even when I palpate. So I'll take a scan, I'll tell you more details.
Okay.
Yeah. So we'll see that. மணி ஒரு ஒன்றாயிடுச்சா லஞ்ச் வந்துருக்காங்க லஞ்சு சாப்பிடலாம் நினைக்கிறேன் இப்போ Yeah, see there is a small spine here on your condyle, and then let me see. Do you snore when you sleep?
No, but just clenching my mother said like that.
You clench your teeth a lot? What kind of work are you doing now?
So actually, I finished my MBA last month. Due to pandemic, I got 1 year degree. So right now, I've been offered a role at Asian Hospital as HR executive at Hyderabad.
Oh, so you're going to work in the hospital?
I mean, like, the interview is Monday, so all goes well and I'll join it.
Cool. All right.
Has it happened something with my ear? Because as I said, I had
I know, I saw that. Maybe no.
no.
So even if it has got to do something with your earlier tympanoplasty, that's something we can't undo now.
Yeah, because when during that surgery, my surgeon he said that I have something TM condition. So during that time, he gave me small instructions like not to.
So that's exactly what I'm saying now. He's called it TMJ issue. I'm calling it lower jaw issue. That's all. The same thing we're talking about. So we can. That has to be corrected only with the surgery, though.
So I mean, we'll take
Yes, it will come forward. Then the position of the jaw joint will improve.
So will it
That might help in your pain relief.
and overall like achieving?
Yes, I think so, because once it gets to a better position, your practicing, all of that will improve.
So if I only lower jaw, what medical?
I think lower jaw primarily. Upper jaw, if you want, we can do to correct your gummy smile. That is cosmetic.
Yeah.
Lower jaw is probably more functional also for you. So you can decide, and then once you decide, then we need to take some measurements and things to plan ahead.
I'll speak to my parents.
Yes, talk to them, everybody, and then once you think you need to go ahead, all right? Yeah.